Several reports are surfacing about adverse reactions to the Johnson & Johnson coronavirus vaccine. Now, around 24 people in 2 states reported adverse reactions to the one-dose shot, ranging from dizziness to nausea. These negative reactions over a 48-hour time period temporarily closed down the vaccine sites where the shots were being given. Joining us now to discuss, Dr. Evan Levine. He's a cardiologist and author, assistant clinical professor of medicine at Montefiore Medical Center, New York, and the director of the Doc Center for Hypertension and Heart Disease. Doctor, thanks so much for being with us today. A lot of people noting, of course, that this perhaps would be a small percentage of those who are actually vaccinated with the J&J vaccine who have seen these negative reactions. But perhaps you could offer some clarity. What maybe caused some of these bad reactions in both North Carolina and Denver? Is there something wrong with the vaccine itself?
No, when I hear about these reactions, I'm not even sure if they're bad reactions to the vaccine. You know, if we look at folks in the United States, 300,000 people every year have reactions to things like blood drawing. And this to me sounds sort of like a vasovagal reaction. Some people see blood, some people have blood drawn, some people get an injection and they get lightheaded. They get anxious. And then if you're in a room where more people are getting lightheaded, like this happened, it may exacerbate problems in other folks. So what I think this is just is anxiety and something sort of like a situational syncope or vasovagal reaction. People get nauseated, their eyesight might be a little changed, they may get lightheaded, that sort of thing. So I'm not sure it has anything really to do with the vaccine, in fact.
So just to be clear, you would still recommend to your patients to get vaccines, even if they do have some sort of anxiety that potentially could be a side effect?
I mean, wouldn't you recommend, if you're a physician, that your patient get a blood draw, even though sometimes they get lightheaded when they have their blood drawn, for example? So absolutely. You know, I don't want to create any hysteria here. We must get everyone vaccinated. So when we see the media report something like this, we have to be extremely cautious. Was this just something like a situational syncope or a vasovagal episode? Mm-hmm. And it sounds to me that's what it was. And that akin to having your blood drawn and getting lightheaded.
Okay, in that context, as you say, of course, is very important here. Also, the distribution, however, of J&J is expected to fall about 85% next week. This is due in part to a factory mix-up here. I'm sure you've seen this story. Workers at a plant in Baltimore manufacturing 2 coronavirus vaccines, they accidentally conflated the ingredients several weeks ago, contaminating up to 15 million doses of the J&J vaccine, forcing regulators to delay authorization of the plant's production line. So I'll ask you here, how might that impact the vaccination distribution plan, considering you might not have as many vaccines to give out?
I agree entirely. I mean, it's sort of shameful that we don't have enough vaccines right now. You know, 450,000 people died during World War II. We have about almost 600,000 people dead now. I say this is World War III. I mean, this should be our priority. We should have these vaccines out there. We should have had them out, and they should have been distributed. So this is a problem. We have to manufacture more vaccine. I mean, the J&J vaccine now is being manufactured, I believe, by Merck as well. And this is a good move. If we look back at World War II, something simple like the Sherman tank, the government allowed 10 manufacturers to make this tank. And we produced almost 50,000 tanks. We need to produce more vaccine and get it out there and distribute it. And the J&J vaccine is important because it's easier to distribute and it's easier to give. It's a one shot and you're done deal.
Yeah, it is. One dose and you're set. Okay, Dr. Evan Levine joining us here live on the program, answering your questions, offering some clarity. We appreciate it. Thanks, doctor.
Thank you.